REN8 is located in the center of the umbilicus. So REN8 is located at the navel. This point is forbidden to needle but can be used with moxa in the case of malabsorption diarrhea or flaccid paralysis of the lower limbs. The navel is filled with sea salt. A thin slice of ginger is placed on it and loose moxa on the ginger. The moxa is slit in several points and left to burn slowly. Remove the ginger slice when the heat is uncomfortable for the patient. REN12 is located on the anterior midline, fourth sun superior to the umbilicus or fourth sun inferior to the sternocostal angle. REN12 is the front mu point of the stomach and the influential point of the hollow organs. REN10, REN12, and REN13, the Sheng1, Zhongwan, and Xiaowan have symbolic names: upper bowl, middle bowl, and lower bowl. They symbolize the stomach as having many lobes. So there is one upper bowl and middle and so on. These 3 points are actually used to nourish the 3 warmers as well as tonify the yin of the pylorus, stomach, and the duodenum. Thus, the upper, middle, and lower parts of the stomach itself. REN14 is located on the anterior midline, tooth zone inferior to the sternocostal angle or 6th zone superior to the umbilicus. REN14 is the front mu point of the heart and a very good point to tonify heart yin, improving its blood nourishing memory holding capacity. REN14 is also used against anxiety, panic attacks, and tachycardia very successfully. It is needled at an angle towards the xiphoid. So here you could see the points that we mentioned. We have CV3, CV12, and CV14. REN15 is located on the anterior midline, 1 zone inferior to the sternocostal angle or 7th zone superior to the umbilicus. REN15 is the luo-connecting point of the meridian, connects to the du meridian and increases the yin of REN meridian. REN17 is located on the anterior midline on the level of the 4th intercostal space. REN17 is the front mu point of the pericardium and the influential point of respiratory organs. REN17 is a dangerous point and should be given subcutaneously with a needle inserted for a distance of 1 to 2 cms. The direction of insertion should be decided beforehand. As with the direction of REN meridian, it would tonify the yin, and against the direction, it would sedate the yin in the respiratory system. REN22 is located 0.5 zone superior to the sternum in the center of the suprasternal fossa. REN22 is a symptomatic point for cough and asthma. It is quite sufficient to needle this point only 2 to 3 mm deep. Massaging this point is also very useful when the patient has a fit of coughing. So here you have the locations of the points that we mentioned: CV15, CV22, and CV17. REN23 is located on the anterior midline, superior to the upper border of the hyoid bone. REN23 is a local point for the larynx and the tongue and often used in hoarse voice and stammering patients. The needling should be perpendicular with the needle pointing towards point 220. It is best if the patient sits for this needle and keeps the head straight without tilting. Once the needle is in, that's about 1 to 1.5 centimeters, please check to see if the needle moves when the patient swallows. If it does, the needle should be pulled to a position where this does not happen anymore. REN24 is located on the anterior midline, below the lower lip, in the mentolabial groove. REN24 is the last point of the meridian. This is used to bring yin from the REN meridian to the face. If a patient seems to hold more yin in the lower body, but the upper body is hot or dry. So we have here the location of REN 23 and REN 24.